we use the Eliquis with a lower dose. I would just say take half the warfarin at their schedule and then start the Yeroto the next day at the same schedule of warfarin. What happens if the iron too high, like 3.5 or 3.5 or 4 or or about 3. So if it is about if the iron about 3.2, then I would just stop the warfarin for 1 day. And then and go ahead and take to the next day. But if it's 3.5, then I might recommend to stop warfarin for 2 days prior to take Yeroto. If it's 3.6 or above, like 4, then stop the Yeroto for 2 to. But if it's more than 4, then I would have to hold the dose and I have the patient to come back in 1 week. I go from there. But I don't. It's about. I have to have the patient to reject the I9. That's I switch from warfarin to Yeroto. So how you switch from Eliquis to warfarin? You can go to Google and type in Eliquis to warfarin. You buy about 300 more than 100,000 from this research. But the top few website have some very important information for you. One, converting the Eliquis of this event. It's recommend start warfarin and stop this event 3 days later. So this is correct, but it still depends on the warfarin level. For example, the baseline for warfarin, before you start warfarin, you need to get the baseline warfarin. Okay? And the normal warfarin is usually below 0.9 or 0.9. So around that level is no warfarin. The people never warfarin. How about if the warfarin level at that time at the base very high, like 0.2, maybe 1 or 1.3, like that. And you may need to stop at this event maybe days or so. And then the second maybe stop at this event and then start the parenteral anticoagulant or the injection anticoagulant. So like Lovenox, and then at the same time. So for some people, high risk of stroke or high risk of complicated situation. So you need to make sure that the patient not have any kind of life-threatening issue. So at that case, you might, if you want to switch to warfarin, then you probably need to make sure warfarin at the therapeutic level. In order to do that, because it takes about 3 to 5 days in order to make sure that I get to the into the therapeutic level, in order to make sure that some injection, like low-level injection, to make sure the patient is not risk of having stroke or blood clot. So that's about what you need to know when you switching from aliquot to warfarin. But you need to make sure you have the baseline iron, and then based on the iron, you may need to make sure when it's safe to switch. Maybe 3 days later, if you have no more baseline iron, if you have high baseline iron, consider to start that with it'll be student. And then if you think that the patient is very high risk of having stroke or dangerous blood clot, then you need to make sure that you have some form of the injection, like low-level injection, the iron level at therapeutic before you stop the low-level injection. Make sure the patient not have stroke or dangerous blood clot, like blood clot in their lungs. Thank you. Switch to what you can type switching about top last church. What results? What result is a aliquot stop maybe it's level. So then you if the eye is less than 9 or so, then I will go for you but stop and feed it. How about I9 is higher than the baseline? See, you know, risk. It's need to make it high blood like in the lung is really good. The eye need certain for that is then and the oxygen that you need adequate and again sun and lower from day for check make the eye level between then stop is that you switch often to eloquent go I often to have pixie band. Partial results. Few website have standing sweet or other or other quicks of the iron two. So I therapeutic in I thought I can walk to I had to send a medic or send innovation medicine when they innovation pick up the medication at the window at the pharmacy, then the patient have the medication ready to switch to the adequate from Walmart. So again, it depends on the iron level, so we can have the patient switch from Walmart to adequate from the outpatient setting. So if the patient inpatient or hospitalized, then it's easy to stop the warfarin and try to retest the iron to make sure it's less than 2 before start taking the Eliquis. It's most easier for the patient to switch to the Eliquis when they're still at the hospital. But if the outpatient management, then you need to stop the warfarin for 2 days. If the iron at the therapeutic level, and then start the Eliquis to make sure the iron less than 2. If the iron a little bit high, like 3.2 or 3.3, then I would recommend to stop the warfarin for 3 days prior to starting Eliquis. But what happens if the iron at the really high, like 3.6 or above in the time visit? Then I would recommend I would reduce the dose or take a partial dose test INA in 1 week to make sure INA level therapeutic before switching to the elements. And when the INA at the therapeutic level, and just try to hold 1 or 2 days prior to the aliquots, prior to starting the aliquot to make sure that INA does. The COVID-19 caused VTE, the venous thromboembolism, the DVT or deep vein thrombosis or pulmonary embolism. You can go to Google, you can type COVID-19 cause VTE. It will show up, about 840,000 results. So the first few results indicate that the patient with the COVID-19 might still increased risk of thrombosis, the DVT or PE. And the most in the medicaltoday.com, it shows that 19 patients might experience the coagulation disorder. And then in the following website, Boston Medical Journal.com, is also show that the patient with the COVID-19 are associated with the venous thrombosis. So, yes, the answer is yes, the COVID-19 might cause the venous thrombosis. So, I have experienced patients who have the COVID and they experience the injury. So the COVID-19 vaccines, it's not much. It's about between 0.5 to 1. For example, people who normally have INA around 2.5, may increase the INA to 3.0 to 3.5 after vaccination. So, but it not last long. Usually, INA increase in about 3 to 4 weeks. They back to the normal target, normal range. So in those the patient who increase the INA due to the COVID-19 vaccines are used to decrease the warfarin dose a little bit, like maybe just a week to make sure the INA is not range, it's not super therapeutic. So, some people concerned whether or not the COVID-19 vaccine affect the INA level. Avoid production or the bigger trend. If you are allergic to Pradaxa, you should avoid Pradaxa for some indication, such as anti-phospholipid syndrome or mechanical heart failure. If you are taking rifampin, St. John's wort, this medication may reduce your side effect. You should, if you are taking verapamil, quinidine, azithromycin, clarithromycin, erythromycin, itraconazole. This medication increase your Pradaxa effect. You should check with your pharmacist or your doctor if you are taking new medication or over the counter when you taking Pradaxa. Some over the counter like Motrin or aspirin are bleeding when you take with Pradaxa. So you let your doctor know when you are taking Pradaxa. You should avoid Pradaxa if you have major and ongoing bleeding with Pradaxa. You should not use Pradaxa for blood clots due to anti-cancer. Typically, for people who have blood clot related to active cancer or global instead. You should check with your doctor who manages your blood thinner medication or the anticoagulation clinic instructions. Please let me know if you have any questions in the comment box below. Thank you. Avoid erythritol or rivaroxaban if you are allergic to erythritol. You should not use erythritol indication such as phospholipid antibody syndrome or mechanical heart failure. You should avoid erythritol if you are taking rifampin, rifadin, carbamazepine, phenytoin, because this medication may reduce your erythritol effect. You should avoid erythritol if you are taking ketoconazole, itraconazole, ritonavir, because this medication may increase erythritol effect. You should check with your pharmacist or your doctor for any other medication to make sure there are no drug actions between erythritol and prescribed medication or over the counter, such as Motrin or aspirin. You should avoid erythritol if you are having an bleeding with erythritol. You should not use if you have blood clots due to active cancer. Just for your general information, you should check with your doctor or your pharmacist if you have any further questions. If you have any questions, in the comment box below. Thank you. Aliquots or you are allergic to Eliquis, you should not use Eliquis. Indications such as for indication like with antibody syndrome or mechanical heart failure. You should not take Eliquis if you are taking rifampin, carbamazepine, phenytoin, because these medications may reduce Eliquis effect. You should, if you are taking hydroconazole, because medication may increase the Eliquis effect. To take conazole or Ritalin have to reduce the Eliquis. If you have major in the Eliquis, you take the Eliquis. If you for the blood clots due to active cancer, generally active cancer, you may try warfarin or dilobenos. This is just for your general information. You should check with your blood medication, your anticoagulant for further instruction. If you have any questions, let me know in the comment box below. Thank you. Heroin addiction. Addiction means you want to have the same feeling the opioid give you. The opioid effect, they give you a good feeling like high, so you continue having that feeling. Heroin is an illegal object. Cocaine, other non-opioid, methaqualone, illegal for noise in OxyContin or it. A lot of people start using heroin after they have come to get the OxyContin. The OxyContin issue to the manufacturer who do. A lot of people will die of the OxyContin extended relief effects overdose. Manufacturers are bankruptcy, and now it has when the supply has problems. The drug cartels take some advantage about that. They start produce the illegal drug, the heroin. The people who have the OxyContin abuse, addiction, dependence, they are looking for a alternate drugs. They are start using heroin. They are start using heroin because this illegal drug is cheaper, but it's equivalent or stronger effects. Heroin dependence or addiction can be physical or psychological. People who have heroin addiction
dose because they want to have the same feeling. Get same feeling. They need to continue to use this drug. When they don't have money to buy the drug, they will commit crimes. You should seek a medical treatment if you think you have drug or opioid dependence. Fentanyl addiction. Fentanyl is the hard topic right now because many illegal migrants enter with the fentanyl. So is an opioid drug. Opioids and prescription opioids. Illegal opioids, including heroin or cocaine. Non-opioid illegal drugs, such as methaqualone. Marijuana may be legal in some states. And prescription opioids, including oxycontin or fentanyl. Fentanyl is a synthetic opioid. And non-opioid methamphetamine. Methamphetamine is a stimulant. The prescription opioids, including oxycontin, fentanyl, due to treat a severe pain. How it works? Fentanyl might block the pain by binding into the opioid receptor cells. So what is the pain? The pain is just a symptom. It's not a disease. For example, arthritis is a disease that might cause a pain symptom. You may have a severe pain after a surgery or a major injury. You should use non-opioid medication, Tylenol, Motrin, research Soma before an opioid or a low-dose opioid as possible to avoid major addiction from a high dose or overdose of the opioid. Fentanyl is being manufactured a lot nowadays from China, and then it gets into the United States via the Mexico border. People who have the heroin or oxycontin addiction or dependence, they start using the fentanyl. Maybe more convenient and it might be cheaper or stronger effects. The OxyContin supply had some issue because there are ongoing lawsuits to its manufacturer, Purdue Pharma. The Purdue Pharma had to file a bankruptcy. Prescription dose for medical treatment, the fentanyl from 25 to 100 microgram per hour. Fentanyl 25 to 100 microgram per hour equals content 10 milligram every 12 hours. Fentanyl is 50 times more potent than heroin and 100 times more potent than morphine per DEA. So, per DEA, the lethal dose 2 or 2,000 tablets or pills from these illegal migrants found more than 2 milligrams. So one tablet contains more than 2 milligrams. It's enough to kill a person who took that tablet or pill. The fentanyl dependent addictions can be physical or psychological. Addiction means you want to have the same feeling the opioid give you. Opioid effect. They give high, so having been addiction. It's easy to get over though because you want to feel better. You want to have, so it's easy to get over. People get over that addiction or dependence may cause crimes due to drug dependence, drug addiction, not control themselves because of psychological. People who have addiction or dependence to fentanyl need medical treatment. You should seek a medical treatment if you think you have drug or opioid dependence or fentanyl addiction dangerous. If you have any further questions, please let me know in the comment box below. Thank you. Oxycontin addiction. Oxycontin is an opioid. Some illegal opioids, including heroin, cocaine, illegal non-opioid drugs such as marijuana, methaqualone. Marijuana may be legal for medical treatment in some states. Some prescription opioids, including OxyContin or oxycodone, fentanyl, hydrocodone, codeine, morphine, methadone, and non-opioid methamphetamine stimulant. What is the OxyContin used for? OxyContin is the brand name for the oxycodone. It is extended relief, so it can last for 12 hours. It's used to treat a severe pain. How it works? The OxyContin might block the pain by binding to the opioid receptors on nerve cells. So what is the pain? The pain is just a symptom. It's not a disease. A disease may be an arthritis. For example, arthritis is a disease that might cause a pain symptom, such as pain. You may have a severe pain after a surgery or a major injury. You should use non-opioid medication, Tylenol, Motrin, research Soma before an opioid. Or you should use a low-dose opioid as possible to avoid major addiction from a high dose or overdose of the opioid. Drug abuse, it can be from the doctors who inappropriately prescribe. Manufacturers may be responsible for if they fail to manage their distribution appropriately. The opioid abuse might lead to addiction, dependence. It can be physical or psychological. Addiction means you want to have the same feeling the opioid gives you. The opioid effect or the OxyContin effect, they give you a good feeling, a high, so to continue having that feeling. It means addiction. It's easy to get overdosed because you want to feel better and better with that feeling. At least the same or better feeling. So you want to have, so it's easy to get overdosed. When people get overdosed, they can be death, addiction, or dependence may cause crimes due to drug dependence, drug addiction. They may not control themselves because of psychological issues. You should seek a medical treatment if you think you have drug or opioid dependence or addiction. To decrease the drug, some states have prescription programs to monitor drivers. The provider also requires patience. So the best thing to avoid is visual content is indicated, such as for after a severe injury. You should stop the medication as instructed by your doctor. You may check to ensure you don't have this. You may use non-opioid pain relief medication, Motrin, when you have a pain symptom instead of. If you let me know in the comment box below. What is atrial fibrillation or AFib? Atrial fibrillation or AFib treatment is atrial fibrillation. Atrial fibrillation is when you don't have time, your heart beat too fast, sometimes too slow. That means you may have a blood clot in your heart or in your lung. If you are diagnosed with AFib, then you might be on a platinum medication indefinitely for the rest of your life. Your cardiologist can convert your heart back to normal. People have AFib, but they don't start the platinum medication first. They don't have any additional risk factors such as over 75 years old or have high blood pressure, diabetes. Generally, if you have only atrial fibrillation and you do not have any additional risk factors, then you don't have to take the platinum medication yet. They may put you on baby aspirin. So when you have a AFib, your doctor needs to select one of the oral platinum medication. If your AFib is not valvular, you may start with the Obadaxa for your convenience. You don't have to the frequent. Your AFib is valvular, then you have to take warfarin. So it is depend on what type of your AFib, and your doctor may put you. If you have any further question on this, please give me. Thank you. Protein C or protein S deficiency treatment duration. This is one of the hypercoagulable states. When medical condition, it may a blood clot disorder or blood clot risk. If you know the cause of the protein C or protein S deficiency, then you may need to take a platinum medication for 6 to 12 months, especially when you have a blood clot in your leg, like deep vein thrombosis. If you don't know the cause, then you may need a platinum medication for the rest of your life. The best medication for this indication is warfarin. Other medication like Eliquis or Azaban, rivaroxaban, Adaxa, Dabitraban. Protein C or protein S deficiency treatment duration. If you know the cause of the protein C or protein S deficiency, then you may need to take a blood thinner medication for 6 to 12 months, especially when you have in your leg like deep vein thrombosis. If you don't know the cause of the blood clot, then you may need to take a blood thinner medication for the rest of your life. The best medication for this indication is warfarin. Other medication like Eliquis or abicipar, Xarelto, the B10. So for this medication, I think there are ongoing studies. Antithrombin or AT deficiency duration. Blood clot disorder or of the hypercoagulable states. If you have antithrombin deficiency, but you don't know the cause, you might need to take the blood thinner medication for 6 to 12 months. If you know the cause of the blood clot, and you might need to take a blood thinner medication for 6 to 12 months. If you don't know the cause of the blood clot, then you may need to take a blood thinner medication the rest of your life, especially when you have a blood clot in your leg or your lung. The best medication for this indication is warfarin. If you have any further question, please let me know in the comment box below. Thank you. Factor V latent deficiency duration. What is factor V latent deficiency? This is a blood clot disorder. It is one of hypercoagulable. There are two types of factor V latent deficiency. First one is homozygous factor V latent deficiency. This is high single risk of having blood clot. If you don't have any blood clot in your leg, your lung, then you may not need to take the blood thinner yet. If you do have a blood clot in your leg or your lung history, you may need to take a blood thinner medication such as warfarin for 6 to 12 months. The second type of factor V latent deficiency is heterozygous. This is the major or multiple risk of having blood clot. If you are diagnosed with this type of factor V latent deficiency, then you may need to take a blood thinner medication indefinitely, regardless of having a blood clot. Medication for this indication is warfarin. There are ongoing studies for the other medications such as Eliquis, Xarelto, Adaxa for this indication. If you have any further question, please let me know in the comment box below. Thank you. Antiphospholipid antibody syndrome, AAS, or lupus anticoagulant. Treatment duration. Antiphospholipid syndrome or lupus anticoagulant is one of the hypercoagulable states. People have lupus may have the antiphospholipid antibody syndrome. This is the blood clot disorder. So they may have blood clot in their leg. If you have antiphospholipid antibody syndrome or lupus anticoagulant, you may need to take a blood thinner medication indefinitely or for the rest of your life. The blood thinner medication for this medical condition is warfarin or Coumadin. You should avoid taking Eliquis, Xarelto, Adaxa. If you have any further question, please let me know in the comment box. Thank you. If you have rheumatic mitral valve disease, you may need to take a blood thinner medication if you have a history of blood clot. And how long you have to be on blood thinner medication for this medical condition. You may need to take the blood thinner medication for the rest of your life or indefinitely. And the best medication for this condition is warfarin. If you have a history of rheumatic mitral valve disease and you have acute blood clot, such as pulmonary embolism, blood clot in your lung, then you may need to take a blood thinner medication for the rest of your life or indefinitely. And the best medication for it is warfarin. If you have any further question, please let me know in the comment box below. Thank you. Pulmonary embolism or PE. What is pulmonary embolism? It is a blood clot in your lung. So how long you have to take a blood thinner medication if you have a blood clot in your lung? If you know the cause of a blood clot in your lung or the cause of the blood clot, you may only need to take a blood thinner medication for about 3 to 6 months. If that is the first time you have a blood clot in your lung. If you don't know the cause, don't know why you have a blood clot in your lung, and if that is the first time you have a blood clot in your lung, you have to take a blood thinner medication for 6 to 12 months. If you have a second time blood clot in your lung or recurrent blood clot in your lung, then you may need to take a blood thinner medication definitely or for the rest of your life. If you have a blood clot in your leg and blood clot in your lung, so that considered recurrent blood clot, you may need to take a blood thinner medication indefinitely or for the rest of your life as well. If the blood clot is considered at high risk for a recurrence, then you may need to take a blood thinner medication longer, maybe for the rest of your life or definitely. And finally, if you have a blood clot in your lung and it's related to an active cancer, then you may need to take a blood thinner medication until you no longer have cancer, and at least for 3 to 6 months. So you have to take a blood thinner medication at least for 3 to 6 months and until you no longer have active cancer. If you have any further question, let me know in the box. Thank you. Deep vein thrombosis or DVT. What is deep vein thrombosis? Deep vein thrombosis is a blood clot in your leg. So, how to be on a blood thinner if you have a deep vein thrombosis or blood clot in your leg? a blood medication in about 3 to 6 months if you know the cause of the blood clot. And if that blood clot is the first time in your life, if you don't know what is the cause of the blood clot in your leg, then you might need to take 6 to 12 months if that is the first time you have a blood clot in your leg. If you have a second time of blood clot or recurrent blood clot in your leg, then you may need to take a blood thinner medication indefinitely or for the rest of your life. If the cause of blood clot in your leg because of an active cancer, then you need to take a blood thinner medication until you no longer have a cancer. This is the general information for how long you need to take a blood thinner medication if you have a blood clot in your leg or a deep vein thrombosis. If you have any further question, please let me know in the comment box below. Thank you. Mitral heart valve treatment duration. If you have mechanical mitral heart valve, you may need to take a blood thinner medication for the rest of your life or indefinitely. The best medication for your mechanical mitral heart valve is warfarin. If you have a bioprosthetic or tissue mitral heart valve, you may only take blood thinner medication for about 3 months. Then you will be put on aspirin for the rest of your life. This is the general information for how long you have to be on blood thinner medication if you have mitral heart valve. You should follow your cardiologist's instructions, including treatment period and duration. If you have any further question, please let me know in the comment box below. Thank you. Transient ischemic attack, TIA, or mini stroke treatment duration. So the duration, it could be clinical adjustment. So it depends. After the TIA, you might need to take the aspirin or warfarin if anticoagulant is indicated. So your doctor will determine how long you have to be either on aspirin or warfarin. Generally, people take aspirin to prevent another TIA. For some people, they would have to take an anticoagulant, such as warfarin, to make sure they are safe from the transient ischemic attack, TIA, or mini stroke. If you have any further question, please let me know in the comment box below. Thank you. Aortic heart valve treatment duration. If you have mechanical aortic heart valve, you may have to take a blood thinner medication indefinitely for the rest of your life. The best medication is warfarin. If you have bioprosthetic aortic heart valve or tissue aortic heart valve, then you might need to take a blood thinner medication for about 3 months, and then explain your life. This is general information for how long you have to take a blood thinner medication. You have aortic heart valve. Your cardiologist will tell you exactly how long you have to be on a blood thinner medication or an aspirin. If you have any further question, please let me know in the comment box below. Thank you. Stroke and blood thinner medication treatment duration. So if you have a stroke and you have to take a blood thinner medication, you know how long you have to be on a blood thinner medication. If you know your causes such as atrial fibrillation or heart valve, then you have to take a blood thinner medication indefinitely or for the rest of your life. The best medication for it is warfarin. If it's not because of embolic causes, then you don't have to take a blood thinner medication, but you may need to take either aspirin or clopidogrel or Plavix indefinitely or for the rest of your life. Your cardiologist will decide treatment, therapy, and duration. So you should follow their instruction. If you have any further question, please let me know in the comment box below. Thank you. Dilated cardiomyopathy treatment duration. If you have dilated cardiomyopathy and you have a history of blood clot or a history of atrial fibrillation, then you may need to take a blood thinner medication for the rest of your life or indefinitely. If you have dilated cardiomyopathy and left ventricular or LV thrombus, may need to take a blood thinner medication for at least 3 months. The best medication, the best blood thinner medication is warfarin. So if you have a history of dilated cardiomyopathy and now you have a blood clot, such as blood clot in your leg or blood clot in your lung, or you have an atrial fibrillation, then you may need a blood thinner medication indefinitely or for the rest. If a history of dilated cardiomyopathy, and now you have a left ventricular thrombus, then you may need to take a blood thinner medication for at least 3 months. The best blood thinner medication is warfarin. You should follow your cardiologist's instructions for treatment, therapy, and duration. If you have any further questions, please let me know in the comment box below. Thank you. Bye. Prior to pacemaker or defibrillator placement, what should you do if you are taking warfarin, Eliquis, Xarelto, or Badaxa? If you are taking warfarin, you should not hold your warfarin. However, you should recheck your INR prior to the procedure. Make sure your INR is therapeutic. If your INR is elevated or critical, and make sure you follow your doctor who manage your warfarin or the anticoagulation to hold your warfarin or dose to make sure it is therapeutic or at the goal level before the procedure. If you are taking Eliquis, Xarelto, or Badaxa, you should check your kidney function to make sure you don't have any bleeding complication of the procedure. You should continue to take the Eliquis, Xarelto, otherwise as indicated, instructed by your procedure list. If you have any question or concern for me, please let me know in the comment box below. Thank you. Prior to pacemaker or defibrillator battery change, what should you do if you are taking platinum medication such as warfarin, Eliquis, Xarelto, or Adaxa? If you are taking warfarin, you should not hold your warfarin if your warfarin is therapeutic. If your INR is elevated or critical, then you should recheck your INR prior to the procedure. It's best if your INR is therapeutic before the procedure. If you are taking Eliquis, Xarelto, or Adaxa, you should check your kidney function. Do not hold unless otherwise as indicated. You should follow your surgeon or procedure list instruction. If you have any further question or concern before this procedure, please let me know in the comment box below. Thank you. What should you do prior to lung biopsy procedure if you are taking a platinum medication such as warfarin, Eliquis, Xarelto, or Adaxa? If you are taking warfarin, you should recheck your INR about 2 weeks prior to the procedure. If your INR is therapeutic and you are stable with your warfarin, like you have a stable INR history, then you should hold your warfarin for 4 to 5 days prior to the procedure. If you have a critical INR like over 5, then you may need to hold your warfarin and then reduce your warfarin dose and recheck your INR in about 1 week prior to a procedure. If you have to hold your warfarin for more than 3 days, you should reach with a luminal injection to prevent from recurrent blood clot or stroke. You should follow your doctor or the anticoagulation for breaching instruction. If you have to take the Eliquis, you may need to check your kidney function. If your kidney function is normal or creatinine clearance greater than 50, then you may only need to hold your Eliquis, Xarelto, or Adaxa for 2 days. If your kidney function is not normal when your creatinine clearance less than 50, then you may need to hold your Eliquis, Xarelto, or Adaxa for more than 2 days. When you hold for more than 2 days, then you may need to delay to resume your Eliquis, Xarelto, or Adaxa. You should follow your surgeon or procedure list to resume your platinum medication. Any question, you should check with your doctor who managed your platinum medication or your anticoag clinic. If you have any question for me, please let me know in the comment box below. Thank you. Prior to lung removal procedure, what should you do if you are taking platinum medication such as warfarin, Eliquis, Xarelto, or Adaxa? If you are taking warfarin, you should in about 2 procedure. If your INR is therapeutic and your INR history is stable, then you may need to hold your warfarin for 4 to 5 days prior to the procedure. If your INR is critical or elevated, your doctor who manages your warfarin or your anticoagulant might need to hold your warfarin or reduce your warfarin dose and recheck your INR in about 1 week to make sure your INR is good before they can plan for your procedure. If you have to hold your warfarin for more than 3 days, then you may need to be rich with your low injections to prevent from having recurrent blood clot or stroke. If you are taking Eliquis, Eroto, or Badaxa, you may need to check your kidney function. If the creatinine clearance is less than 50, to hold your Eliquis, Eroto, Badaxa for more than 2 days prior to the procedure. If creatinine clearance greater than 50, then you only need to hold your Eliquis, Eroto, or Badaxa for 2 days prior to the procedure. You may need to delay to resume if you hold for more than 3 days. You need to follow your doctor or the anticoagulant instruction. You should resume your blood thinner medication as instructed by your surgeon or procedure list. If you have any further questions, please let me know in the comment box below. Thank you. Spleen surgery or the vascular surgery related to spleen. Prior to spleen surgery, what to do prior to spleen surgery if you are taking warfarin or Eliquis or Eroto or Badaxa. If you are taking warfarin, you should recheck your INR in about 2 weeks prior to the procedure. If your INR is at therapeutic, you should go ahead and hold your warfarin for 4-5 days prior to the procedure. If your INR is a little bit elevated, you should adjust the dose a little bit and hold your warfarin for 4 to 5 days prior to the procedure. If your INR is very elevated or critical, then you need to hold your warfarin and reduce the dose and come back in about 1 week to make sure your INR improve, get back to the therapeutic level. Then before you can plan for the procedure. Anytime you need to hold your warfarin for more than 3 days, then you need to reach with the low injection. If you have a history of recurrent blood clot or stroke and strong risk factor of having blood clot or stroke, such as factor 5 deficiency. If you are taking the low injection to bridge when you off warfarin, you need to follow your doctor who manages your warfarin or the anticoagulant instruction closely. Make sure you understand when you need to start the low injection, when you need to stop the low injection before surgery, when you need to resume after the surgery, and when you need to completely stop the low injection therapy. If you are taking Eliquis, Eroto, or Badaxa, you should check your kidney labs, make sure they are up to date. If they are more than 3 months old, then you need to update the labs. For those people who have kidney problems, such as kidney failures or chronic kidney disease, they should get the update lab. They should get the update lab sooner than 3 months. If they have a normal kidney function, if your kidney function is normal, you should hold for 2 days and resume the day after the procedure. If your kidney function is not normal, your creatinine clearance less than 50, you might need to hold more than 2 days, and you might need to delay resuming your Eliquis, Xarelto, or Badaxa. You also need to check with the surgeon or proceduralist to make sure if you are safe to resume your platinum medication. When is safe? When you are safe to resume your platinum medication. If any different, you should update to your doctor who manage your warfarin, your anticoagulant. If you have any further question, please let me know in the comment box below. Thank you. Liver surgery or vascular surgery related to liver. What to do prior to liver surgery if you are taking a blood thinner medication such as warfarin, Eliquis, Xarelto, or Badaxa. If you are taking warfarin, I will recommend that you should recheck your INR about 2 weeks prior to the procedure. If the INR result is therapeutic, then you should hold your warfarin 4 to 5 days prior to the procedure. If the INR result is faded, then you should adjust your warfarin dose a little bit and hold 4 to 5 days prior to the procedure. If you have very elevated INR or critical INR, then you may need to hold your warfarin and reduce the dose and come back in 1 week to recheck your INR to make sure your INR improve, return to therapeutic range before you can plan procedure. So you should follow your doctor who manage your warfarin and anticoagulant closely to be appropriate for surgery. Anytime you have to hold your warfarin more than 3 days, I would recommend that you should consider reaching with the Lovenox injection if you have a history of recurrent blood clot or stroke and strong risk factors of having blood clot or stroke, such as factor V deficiency or some kind of genetic. If you have to reach with the Lovenox injection, you need to follow your doctor or the anticoagulant closely to make sure you understand when you need to start Lovenox injection, when to stop Lovenox injection for the surgery, and when to resume the Lovenox injection after the procedure, when completely stop the Lovenox injection therapy. If you are taking the Eliquis, Xarelto, or Badaxa. You should check your kidney labs, make sure they are up to date within 3 months. If you have kidney problems such as kidney failures or kidney disease, then you need more update labs than the normal people. If your kidney labs within normal limits, then you should hold for 2 days. If the creatinine clearance not within normal limit, for example, if less than 50, then you may need to hold more than 2 days. You should resume your Alaquix, Geroto, or Badaxa the day after the procedure if your kidney function is normal. You should delay resuming your Alaquix, Geroto, Badaxa if your kidney function is not normal. You may resume 2 to 3 days after the procedure. You should also check with your surgeon or proceduralist. Make sure you are safe to resume your platinum medication. If any difference, you need to talk to your doctor who manages your platinum medication or your anticoagulation. If you have any question, concern, please let me know in the comment box below. Thank you. Liver biopsy, what to do prior to liver biopsy procedure if you are taking a blood thinner medication such as warfarin, Eliquix, Geroto, or Badaxa. If you are taking warfarin, you should recheck your INR about 2 weeks prior to the procedure. If your INR is therapeutic, then you may need to hold your warfarin for 4 to 5 days prior to the procedure. If your INR is elevated, then you may need to adjust your dose to make sure your INR improve. Even your INR history is stable, and then hold your warfarin for 4 to 5 days prior to the procedure. If your INR is very elevated or critical, then you need to fix your INR and reduce. You need to hold your warfarin and reduce the dose and come back in 1 week to recheck your INR to make sure your INR improve or therapeutic before you can plan for the procedure. You should follow your doctor who manages your warfarin or the anticoagulation closely to have a good plan for your procedure. Anytime if you hold your warfarin more than 3 days, then you might need to consider bridging with the lobanol injection. If you have a history of recurrent blood clot or stroke and strong risk factor of having blood clot or stroke, if you have to take the lobanol injection, you need to follow your doctor who manages your warfarin or the anticoag instructions closely. Make sure you understand when you need to start the lobanol injection, when you need to stop the lobanol injection right before the procedure, when you need to resume the lobanol injection, when you need to completely stop the lobanol injection therapy. If you have Wix or Yeroto, you should check your kidney labs to make sure your kidney function is normal. If your kidney labs are 3 months old, then you need updates. If you have kidney problems such as or chronic kidney disease, you may need sooner than 3 months. If your kidney function, excuse me, if your kidney function is normal, then you only need to hold for 2 days prior to the procedure. If creatinine clearance less than 50, then you may need to hold your Aliquis, Xarelto, or Badaxa more than 3 days, and you may need to resume about 2 to 3 days after the procedure. If your kidney function is normal, you can resume your Aliquis, Xarelto, Badaxa in 1 day after procedure, the day after the procedure. If your kidney function is not normal, your creatinine clearance less than 50, then you may need to delay resuming your Aliquis, Xarelto, or Badaxa. You should also check with the surgeon or proceduralist when it's safe to resume your blood thinner medication. If any different, you should let your doctor who manages your warfarin or blood thinner medication or the anticoagulation so they can update the recommendation. If you have any question for the liver biopsy procedure, if you are taking warfarin or other blood thinner medication, please let me know in the comment box below. Thank you. Transurethral resection of the prostate, TURP procedure. What should you do prior to transurethral resection of the prostate procedure if you are taking a blood thinner medication, such as warfarin, Aliquis, Xarelto, or Badaxa? If you are taking warfarin, I would recommend you should recheck your iron about 2 weeks prior to the procedure. If you have a therapeutic INR, then you should hold for 4 to 5 days prior to the procedure. If your INR is elevated, you may need to fix your INR, come back in 1 week to see if it improved, and plan for the procedure. If your INR critical, you need to hold warfarin, reduce the dose, and come back in 1 week, check your INR, plan for the procedure. Anytime you hold your warfarin more than 3 days, you consider reaching with the lobanal injection if you have a history of recurrent blood clot or stroke and strong risk factors of having blood clot or stroke. If you have to reach with the lobanal injection, you should follow your doctor who manages your warfarin or the anticoagulant instruction closely to understand when you need to start the lobanal injection, when you need to stop before the procedure, when you need to resume it at the procedure, when you stop the lobanal injection quickly. If you are taking the Aliquis, Xarelto, or Badaxa, you should check your kidney function, your renal labs. Make sure you are up to date. If your labs were done more than 3 months ago, then you may need to eat. If you have kidney disease, kidney failure, you may need to repeat the lab sooner. If your kidney function is normal, you need to hold for 2 days. If your creatinine clearance less than 50, to hold more than 3 days, and you delay resuming. You should check with the surgeon or proceduralist to see if you are safe from resuming platinum medication. If any different, you should check for doctor who manage your platinum medication or the anticoagulation. Make sure they have the updates. If you have any question or concern about this procedure, what to do prior to this procedure, and or if you are taking platinum medication, please let me know in the comment box below. Thank you. Bladder tumor procedure. What should do prior to bladder tumor procedure? If you are taking warfarin, Eliquis, Xarelto, or Badaxa, I would recommend you should recheck your INR about 2 weeks prior to the procedure if you are taking warfarin. If you have a therapeutic INR result, then you may need to hold your warfarin 4 to 5 days prior to the procedure. If your INR result is elevated, just slightly high, then and you have a stable INR history, then you may need to adjust your INR a little bit to make sure it get back to the therapeutic range. Then you hold for 4 to 5 days prior to the. If your INR result is critical, probably you need to fix that INR by holding your warfarin and reduce the dose to make sure the INR back to the therapeutic range, or plan for the procedure. Anytime hold your warfarin more than 3 days, you need to consider switching to the lobanal injection if you have a recurrent blood clot or stroke history, and you have strong risk factor of having blood clot or stroke, then you need to treat with lobanal injection of warfarin for more than 3 days. Your doctor who manages your warfarin or the anticoagulant will give you a separate instruction for the lobanal bridging. You should follow the instruction closely to understand when you need to start lobanal injections, when you need to stop them before the procedure, when you need to resume them, when you need to stop the lobanal injection quickly. If you are taking the Eliquis, Xarelto, or Badaxa, you should check your kidney labs. Make sure it's up to date. If they are more than 3 months old, then you may need the labs. If you have kidney failures or kidney disease, then you may need to consider updating your lab sooner than 3 months. If your kidney function is within normal limit, then you may need to hold for only 2 days prior to the procedure. If your kidney functions is not normal, as your creatinine clearance less than 50, you might need to hold more than 2 days. And you might need to delay resuming your Eliquis, Xarelto, or Badaxa. You should check with the surgeon or proceduralist. Make sure if you are safe to resume your platinum patient after the procedure. If anything different, you need to discuss with your doctor who manage for platinum medication or anticoagulation. If you have any question, concern, please let me know in the comment box below. Prostate biopsy procedure. What to do prior to prostate biopsy procedure if you are taking a platinum medication like warfarin, Eliquis, Xarelto, Badaxa. If you are taking warfarin, I would recommend that you should recheck your INR about 2 weeks prior to the procedure. If your INR history is stable and your INR result at therapeutic, then you will need to hold for 4 to 5 days prior to the procedure. If your INR history is not stable, your INR result is elevated, then you may need to adjust the dose and come back 1 week if needed to make sure your INR improve before and plan for the procedure. If your INR is critical, then probably you need to hold your warfarin and adjust the dose, reduce the dose, then come back in 1 week. Make sure your INR is improved so you can plan for the procedure. If you have to hold your warfarin for more than 3 days, then you should plan bridge with the lower node injection. If you have history of recurrent blood clot or stroke and strong risk factor for having blood clot or stroke. If you have to bridge with the lower node injection, you should follow the instruction from your doctor who manages your warfarin or the anticoagulant to make sure you understand when to start the lower node injection, when you need to stop for the procedure, when you should resume the lower node injection. If you are taking the Eliquis, Xarelto, or Badaxa, you might need to check your kidney function. Make sure you have up-to-date labs. If your labs more than 3 months old, then you need to repeat your labs. If your kidney labs are normal, then you may need to hold for 2 days prior to the procedure. If your kidney function is not normal, you have kidney disease, and your creatinine clearance less than 50, then you may need hold your Eliquis, Geroto, or Badaxa more than 2 days. If you have normal kidney function, then you may need to resume 1 day after the procedure. If your kidney function is not normal, then you may delay to resume your Eliquis 2 to 3 days after the procedure. Your doctor who manages your platinum patient or your anticoagulant should give you a complete instruction when to start, when to hold your Eliquis, Geroto, Badaxa, when to resume. You also need to check with the surgeon or the proceduralist, make sure when it's safe to resume your platinum medication. If they give you a different instruction than your doctor who manages your platinum medication or your anticoagulant, should discuss with the doctor or the anticoagulant. Make sure you are on the same page. If you have any further question, concern about the prostate biopsy procedure, please let me know in the comment box below. Thank you. Kidney surgery or vascular surgery related to kidney. What should you do prior to this surgery? If you are taking warfarin, Eliquis, Geroto, or Badaxa. If you are taking warfarin, you should recheck your INR about 2 weeks prior to the procedure. If you have stable INR history and your INR result is at therapeutic range, then you will need to hold for 4 to 5 days prior to the procedure. If your INR history is not stable and you have elevated INR result, then probably you need to fix your INR. Come back in 1 week to see if your INR improve, or you can plan for the surgery. If you have a critical INR result, then probably you need to hold your INR and use the dose. Come back in 1 week, make sure your INR improve, so you can plan for it. You have a history of recurrent blood clot or stroke and strong risk factors of having blood clot or stroke, then you need to be breached with the low enough infection. Your doctor who manages your platinum medication, warfarin, the anticoagulant, will give you a separate instruction. Make sure you understand when you should start the low enough injection, when you need to stop right before procedure, when you need to resume after the. You should follow the instruction closely. If you are taking Eliquis, Geroto, or Badaxa, then you need to check your kidney function to make sure you have the up-to-date labs that require. If your lab more than 3 months old, then you need to repeat them. If your kidney function is normal, then you may need to hold for 2 days prior to the procedure. If you have kidney disease, or kidney failures, and your creatinine clearance less than 50, then you may need to hold for more than 3 days. When you are required to hold for more than 2 days, then probably you need to delay to resume. So if your kidney function is normal, you may resume the day after procedure. If it's not normal, you may resume one day, 2 or 3 days, depend on your kidney. You must also check with your surgeon or proceduralist to see it's okay for you to resume your platinum medication as instructed by the doctor who managed your platinum medication or the anticoagulation. If it is different recommendation, then you need to discuss with, with your doctor who managed your platinum medication. If you have any further questions, please let me know in the comment box below. Thank you. Kidney removal procedure. What should you do prior to kidney removal procedure? If you are taking a platinum such as warfarin, Eliquis, Xarelto, or Badaxa. If you are taking warfarin, you should recheck your iron about 2 weeks prior to the procedure. If you are stable with warfarin for a few months, then and you have a therapeutic result, you might need to hold 4 to 5 days prior to the procedure. If your iron result a little bit high, then a little bit elevated, you may need to adjust your warfarin dose a little bit, then hold 4 to 5 days. If you have really high or very elevated INR or critical INR, then probably you need to fix your INR to make it therapeutic before you can plan for the procedure. You may need to come back in 1 week to see if your INR improved, so you can plan for the procedure. And if your INR improved, then you might need to hold 4 to 5 days prior to the procedure. When you hold your warfarin more than 3 days, you should plan for reaching with a lobanal injection if you have a history of recurrent blood clot, recurrent stroke, and strong risk factors of having blood clot or stroke. When you have to prescribe the lobanal injection, it should give you a separate instruction when you need to start your lobanals, when you stop before the procedure, when you should resume your lobanals after the procedure. If you are taking Eliquis, Xarelto, or Badaxa, you may need to check your kidney function. Make sure you have up-to-date labs. If you have your current labs more than 3 months old, in the labs within normal limit, then you may need to hold for 2 days prior to the procedure. If your kidney labs not within normal limit, if you have kidney disease and your creatinine clearance less than 50, and you may need to hold more than 2 days. When you need to hold more than 2 days, then you may need to delay to resume your Eliquis, Xarelto, or Badaxa. So, your doctors who manage you, Eliquis, Xarelto, or Badaxa, or the anticoagulation will give you the complete instruction when you need to hold Eliquis, Xarelto, or Badaxa and to resume after the procedure. However, you should check with your surgeon or proceduralist to make sure you are safe to resume your platinum medication. If you need to delay to resume your platinum medication, then you need to discuss that with your doctor who manages your platinum medication. If you have any further question, please let me know in the comment box below. Thank you. Kidney biopsy procedure. What should do prior to kidney biopsy procedure if you're taking platinum medication such as warfarin, Eliquis, Xarelto, Badaxa? If you're taking warfarin, you should recheck your INR about 2 weeks prior procedure. If your INR history is not stable and your current INR is critical, then you need to make sure your INR back to normal at therapeutic level. So they might need to hold your warfarin and reduce the dose and have you come back in 1 week to make sure that your INR return to the normal range, to the therapeutic range, before they can plan for the procedure. When your INR has the therapeutic range, they will have you to hold for 4 to 5 days prior to the procedure. If you have medical condition indicated you must be breached with the Lovenox injection, then your doctor who manage your warfarin or anticoagulation, they will instruct you how to start your Lovenox injection, when to stop, when to start your Lovenox, when to stop Lovenox before the procedure, and when to resume. That's very important. You need to follow your doctor who manage your warfarin or the anticoagulant. If you are taking the Eliquis, Xarelto, or Badaxa, you may need to check your kidney function. Make sure you have up-to-date labs that require. If your lab more than 3 months old, then you may need to eat the labs. It depends on your kidney function. You may need to hold more than 2 days. If you have normal kidney function, you only need over 2 days prior to the procedure. If you have kidney disease or kidney failures, and your creatinine clearance less than 50, then you may need to hold Eliquis, Geroto, or Badaxa more than 2 days. When you have bad kidney function, then you may need to delay to resume your Eliquis, Geroto, or Badaxa. Your doctor who manages your blood thinner medication or your anticoagulant will give you complete instruction when to stop, to resume Eliquis, Geroto, or Badaxa based on your kidney labs. But you may need to ask or check with your surgeon or proceduralist when is the best time to resume. If they delay to resume your blood thinner medication, you need to discuss that with your doctor, manage your blood thinner medication or your anticoagulant. If you have any further question regarding your kidney biopsy procedure, let me know. Prior to ablation procedure, what should you do prior to ablation procedure if you are taking blood thinner medication or when you're taking blood thinner medication? Do not hold your blood thinner medication unless otherwise as instructed. For warfarin, you should test for INR weekly, 3 to 4 weeks prior to the procedure. Test INR weekly, 3 to 4 weeks post-procedure. Your INR must be therapeutic every week before the procedure. If for some reason your INR not therapeutic, then you may need to restart the cycle. If you take Eliquis, Geroto, or Badaxa, you should continue taking this medication unless otherwise as instructed. If you miss any dose, you should report to the proceduralist or the anticoagulant. Cardioversion. What to do prior to cardioversion procedure if you are taking blood thinner medication such as warfarin, Eliquis, Geroto, or Badaxa. Typically, you must be on blood thinner medication before they came to cardioversion procedure. And do not hold your blood thinner medication prior and after cardioversion. You must test your, if you take in warfarin, you must test your INR weekly. You must test your INR weekly for 3 to 4 weeks prior to the procedure. And then test your INR weekly for 3 to 4 weeks post-procedure. Your INR weekly must be therapeutic or in range before they can perform the procedure. If your INR not therapeutic, not in range, they need to restart the cycle 3 to 4 weeks prior to the procedure. And then after the procedure, your INR is supposed to be therapeutic. If not, if your INR too low, they may need to reach you with a lobanol injection. For the Eliquis, Geroto, or Badaxa, you have to continue taking this medication. If you miss any dose, you need to report to the proceduralist or your anticoagulant, or the doctor who made the warfarin, or platinum medication. So generally, you should not hold your platinum medication before and after the cardioversion, always or with after. If you miss any dose, you should let your doctor know. The surgeon or proceduralist or the anticoagulant, so they have to adjust your cycle. Most of the hospital, they prefer you to take warfarin before after the cardioversion instead of other platinum medication, Eliquis, Xarelto, or Badaxa. If you have any further question, please let me know in the comment box below. Thank you. What should you do prior to cardiac catheterization or heart cath when you or if you taken platinum medication such as warfarin, Eliquis, Xarelto, or Badaxa? Cardiac cath is the serious surgery, so if you take warfarin and you are stable with your INA history, or if your INA history is stable for a long time, then you should recheck your INA about 2 weeks prior to the procedure. You might need to hold your warfarin 4 to 5 days prior to the procedure. You may need to be bridged with a Lovenox injection if you have a history of recurrent blood clot or stroke, or you have strong risk factors for increased risk of stroke or blood clot when you're off warfarin more than 3 days. If you have to bridge with Lovenox injection, and you need to follow your doctor who managed your warfarin or the anticoagulant. Make sure you understand when to start the Lovenox injection and when to before the procedure, and when you can resume the Lovenox injection. If your INR result slightly high, you might require to reduce the dose and recheck in 1 week, or reduce the dose and hold for 4 to 5 days prior to the procedure. For the Eliquis, Xarelto, Badaxa patient, they might need to check the kidney lab, make sure their kidney is normal. They probably need to update the labs if their previous labs were done more than 3 months. If their kidney function is normal, they may need to hold for 2 days prior to the cardiac cath surgery. If they have unstable kidney function or chronic kidney disease, and their creatinine clearance that done, then they may need to hold more than 2 days. If they have to hold for more than 2 days, then they might need to delay resuming the Eliquis, Eroto, or Badaxa. So the doctor who managed your Eliquis, Eroto, or Badaxa, or the anticoagulant will give you specific direction or instruction when to hold your Eliquis, Eroto, or Badaxa, and when to resume. But you should check with your surgeon or proceduralist to make sure when to resume, because sometimes I have bleeding after the procedure or surgery. So your surgeon or proceduralist may delay to resume your platinum medication. Please let me know if you have any question in the comment box below. Thank you. Hello. What should you do prior to colonoscopy procedure if you are taking platinum medication, such as warfarin, Eliquis, Eroto, or Badaxa? For warfarin, you should recheck your INR about 2 weeks prior to the procedure. The INR is therapeutic and should hold your warfarin for 4 to 5 days prior to the procedure. You may need to be bridged with the Lovenox injection if needed. If you have recurrent blood clot history or recurrent stroke history or any strong risk factor indicating you have high risk of blood clot or stroke when you off warfarin more than 3 days, then need to be bridged with the Lovenox injection of warfarin for more than 3 days. If you have a very elevated INR, like critical INR, then you need to hold your warfarin and reduce the dose of warfarin to get to the therapeutic before you can plan for the procedure. If your INR slightly high, then need to adjust and recheck in 1 week if needed, or should adjust the dose and plan to hold for 5 days or so for the procedure. If you have to use the Lovenox injection for bridging, then you should follow your doctor who manage your warfarin for the anticoagulant. Make sure you understand when to start the Lovenox injection and when to stop before the procedure, when to resume the Lovenox after the procedure. If you are taking Eliquis, Eroto, or Badaxa, you probably need to check your, if not within 3 months. Your Aliquots, Yeroto, Badaxa may need to be held for 2 days prior to colonoscopy procedure. If you have a normal kidney function, if you have a kidney disease or your kidney function is not normal, like your serum creatinine not within normal limit, then you may need to hold your warfarin. Excuse me. Then you need to hold your Aliquis, Geroto, or Badaxa more than 2 days. When you need to hold your Aliquis, Geroto, or Badaxa more than the Johnson issues, then you may need to delay to resume this medication. So typically, you resume Aliquis, Geroto, or Badaxa 1 day after the procedure. But if you have kidney problems, then you may need to resume your Aliquis, Geroto, or Badaxa 2 days or more. So you need to follow your doctor who manage your warfarin for your anticoagulant and your surgeon or proceduralist. You don't have to reach when you hold for your Aliquis, Geroto, or Badaxa. You should check with the surgeon or proceduralist to make sure when it's safe to resume your blood thinner medication. If your surgeon or proceduralist recommend to delay to resume your blood thinner medication, you should report that to your doctor who managed your blood thinner medication or your anticoagulant so they can update the recommendation in the systems. If you have any question, concern, please let me know in the comment below. What should you do prior to a dental caps procedure? You don't have to hold your blood thinner medication prior to the dental cap procedure. That's by your doctor who managed your blood thinner medication or anticoagulant. If you are taking warfarin and you don't have a stable history and you have a critical INR recently, and you might need to check your INR prior to and unless your dental oral surgeon know that you have critical INR recently. If you have any active bleeding, you know to make sure everything's safe. They don't do it now beside the dental caps procedure. And if they want you to hold your warfarin prior to this procedure, then you probably need to discuss with your doctor for blood thinner medication or the anticoagulant or recommendation. If you have to hold your warfarin, follow your
doctor or the anticoagulant instruction. If you have to hold your language, that may need to one day, right? Need it. Again, you need to discuss for doctor any recommendation or hold. If you have to hold your warfarin or Aliquid, talk about that, you need to check dental. See when you platinum. If they don't have any instruction, when you need to, then you need to consult with doctor, manage your platinum patient or your hypoid for the instruction. You have no active bleed, they may let you resume the platinum medication same day after the prior to a dental caps procedure. You don't have to hold for platinum medication unless otherwise it's instructed. Check your INI if needed. Critical INI recently or INI history not stable. You have active. You should let your dental or health surgeon know if you have any concern like active bleeding or any major bleeding that you have in that or platinum medication. Okay, if you have any further questions, concern, please let know in for the dental cleaning procedure, what you need to do prior to dental cleaning procedure, if you are taking platinum medication like warfarin, Aliquid, Boto, Badaxa, so I would recommend that you should not hold platinum medication for routine dental cleaning. If your iron, if you're taking warfarin, you need to make sure you are stable with your iron level. You don't have critical iron before routine cleaning. If you have critical iron, probably you need to hold your warfarin for a few days in order to get your iron to the therapeutic level. So avoid your routine cleaning if you just have a critical iron like over 5 or your iron over 6, or you have any active bleeding with over or platinum patient. For the deep cleaning, if you have a deep cleaning in platinum medication, consider to hold your warfarin. You need to check with your doctor who manage your platinum medication. They have to review your iron history, and then they will give you some recommendation on your warfarin and your iron history. Generally, if you have a stable iron history, then and then your current iron is therapeutic, and they might recommend that you hold for one day prior to the procedure. If your iron, if your iron is not stable and has a history of elevated iron, then they may recommend that you should hold for 3 days prior to the procedure.
but they need to test you and right to the procedure, usually within 24 hours of the procedure. Um, and then if you are taking that's um, and then you don't have any kind of bleeding or anything, any active bleeding, such as nose bleeding, stomach bleeding, or blood in your urine, and then you might need to hold for 1 day, right, to keep cleaning. And again, if your dentist, they are not concerned about your bleeding, and then they don't recommend you have to hold your blood thinner medication, then you should not hold your blood thinner medication. You don't have any concern about bleeding. If you are stable with your warfarin doses, and then you have a good history of your INR, therapeutic for a long time, then you recommendation. If you have concern, you should always ask your doctor who manage your warfarin. Make sure you are safe from any procedure. Okay? If you hold your warfarin or your Eliquis, you should resume your blood thinner medication as instructed by dental. If you have any question, you ask your doctor who manage your warfarin when blood thinner medication. Generally, if you don't have any kind of bleeding or if you don't have any instruction from your dental when to resume your warfarin, then your doctor who manages warfarin might have you to resume your warfarin after the procedure. But you need to double check you are safe. All right. So any further question or any concern prior to dental procedure, what you need to do when you are taking the blood thinner medication, please let me know the comment below. Thank you. Bye. Hey, prior to a dental grounds procedure, what should you do if you are on blood thinner medication? If warfarin, Eliquis, Xarelto, Badaxa, I would recommend should not hold any blood thinner medication by this procedure. Otherwise, as instructed by your doctor who manage your warfarin or blood thinner medication or typhoid. You should check your INR warfarin if you have a critical INR recently, if your INR history not stable, you have active bleeding like blood in urine, stool, pop up with stomach bleeding, things like that, then you need to let your dental know that you have some concern with your bleeding. And then you might need to make sure your INR not too high prior to avoid any major bleeding. Sometimes your dental may find something that may want to do additional procedure, then will cause a problem if they're not aware of critical INR or actively that if they want you to hold your warfarin prior to dental grounds procedure, then you need to discuss with your doctor who manages your warfarin or other blood thinner medication, or you need to discuss with
anticoagulant, sure you have the instruction. And then if they want you to hold your Eliquis, Xarelto, or Badaxa prior to the procedure, for this procedure, you may need to only hold the blood thinner medication for a day prior to the. Again, you need to talk to your doctor who manages your Eliquis, Xarelto, or Badaxa, or talk to your anticoagulant for the instruction. If you have to hold your blood thinner medication prior to the procedure, then you should ask your dental when to resume your blood thinner medication. If they don't have any instruction or any recommendation, then you need to discuss with your doctor who makes blood thinner medication or the anticoagulant. Generally, if you don't have any bleeding after the procedure, right, resume the blood thinner medication day or a day after the procedure. If you have any question, any further question, then let me know in the comment below. Prior to the dental extraction procedure, taking anticoagulant like warfarin, Eliquis, or Xarelto, you should know what to do prior to dental extraction. If a simple extraction, like one tooth extraction, I would recommend not hold any blood thinner medication. But I would recommend SUI now prior to the procedure if you are not stable. If you are not, you have a lot of out range, especially either your upper range. You should check your INA prior to avoid bleeding. So, if you have multiple tooth extractions, then I would recommend to hold from 2 to 5 days prior to the procedure. You should check with your dentist or oral surgeon. You see what they expect. Some dentists, they may tell you they want INA between 2 and 3, or they want INA less than 2 prior to the procedure. Then you will let your doctor who manages your warfarin know that your INA expect to be at certain level prior to the procedure. Usually, they want your INA on the day or within 24 hours prior to the procedure. So, if you are in excuse me, if you are in not stable or higher than the upper range, like a week or 2 weeks prior to the procedure, then you should hold your warfarin to make sure you get or you achieve the INA goal. Expect to be within 24 hours. So, for example, if your INA like 3.5, 2 weeks prior to the procedure, right? So, I would recommend you need to hold your warfarin 1 day prior to the procedure. And then you need to detach the INA on the day of procedure. So to make sure you are in at 2.3, 2 to 3, that's what your dentist want. If your dentist want your INA less than 2 prior to the procedure, then you might need to hold for 3 days if your INA you know, for 3.5, 2 weeks prior to the procedure. And you go like 3 days prior to the procedure to make sure you are not less than 2. So it still depends on what your dentist want or expect you are not level or goal before the procedure. If you have to hold your eye now, hold your open for 5 days prior to the procedure. Okay, sometimes they have difficult or multiple tooth extraction. They may want you to hold for 5 days prior to the procedure. They want the INR level less than 1.5. And you need to hold your warfarin might be for 5 days or more, depending on your INR level. So you have to follow your doctor closely to make sure it. So if you have to hold your warfarin for 5 days to get the INR at less than 1.5, then you may need to be breached with the lower knob injection or inoxaparin injection to avoid, the blood clot or stroke, because you take warfarin to prevent the blood clot or stroke. And then if you require to reach with the instruction, when to start the lower nose and when to resume lower nose injection, you have to follow the doctor who manage your warfarin. If you take Eliquis, Yeroto, or Badaxa, it's easier to manage prior to the procedure. Generally, for a simple extraction, you don't have to hold Eliquis, Yeroto, or Badaxa, but for multiple tooth extractions or extensive oral surgery, then you might need to hold for 1 to 2 days this medication prior to the procedure. You don't have to be breached with the lower knob injection when you hold less than 3 days. I think generally it's safe, except for certain patients. They are so sensitive when they hold their blood thinner medication, even though 2 days they may develop the blood clot or stroke. So for those patients, the surgeon or the proceduralist might need to consider the risk and benefits of holding the blood thinner medication. So that's a very complicated patient. Need to work closely. They may need to be stay at the hospital before the procedure to make sure they are safe, or stay after the procedure for days to make sure they are safe from bleeding or blood clot or stroke. If you have to hold your warfarin or the Eliquis, Yeroto, Badaxa, then resume your blood thinner medication as instructed by dental or the surgeon. So prior to the dental extraction procedure, you need to know if that's a simple extraction or multiple tooth extraction. If simple extraction, you may not need to hold your blood thinner medication. If multiple tooth extraction or extensive oral surgery, then you may need to hold your warfarin for 2 to 5 days, depending on your INR level. And then if you hold more than 3 days, then depending on your medical condition, you need to be breached with the luminal injection to make sure you are safe from blood clot or stroke. And if you take an Aliquid, Xarelto, or Badaxa, you may require to hold 1 to 2 days prior to the multiple tooth extraction or extensive oral surgery. And then you should resume your blood thinner medication as instructed by your dental. And if you have to be briefed with luminal injection, then you have to follow your doctor who manage your warfarin to make sure you know what day you need to start the Lovenox and what day and when you resume your Lovenox and when to start the Lovenox injection. All right, if you have any further questions for this dental extraction procedure, please let me know in comment below. Thank you. Prior to dental fillings procedure, what should you do if you are on blood thinner medication, such as warfarin, Aliquid, Xarelto, or Badaxa? You don't have to hold your blood thinner medication prior to a dental fillings procedure unless otherwise as instructed by your doctor who manages your warfarin or your anticoagulation or your dental or your oral surgeon. Okay. If you have a unstable, unstable INR history, then you may consider to reject your INR. If you have a critical INR recently, then you should check your INR, make sure your INR is not too high prior to the procedure. If you have any active bleeding, you should let your dental or your surgeon know that you have active bleeding. But I don't think that they need to do, they need to postpone the procedure, this procedure, that you have bleeding, why not too high? But if you need to talk to them to make sure they don't do anything else besides the fillings. They require you to hold the warfarin, and you need to follow your doctor who manages the blood thinner medication or the anticoagulation. And if they require you, if you're taking the Aliquid, Xarelto, or Badaxa, and they require you to hold your blood thinner medication prior to the procedure, have to. And if you have to hold your blood thinner medication, then you resume your blood thinner medication instructed by your dentist or your surgeon. If they don't have any recommendation, they have no idea when to resume, then you need to check with your doctor who manages your blood thinner medication or the anticoagulant, when you should resume blood thinner medication. If you don't have any higher bleeding after the procedure, then might resume the blood thinner medication on the day after the, or even 10 day of the procedure, you have no bleeding done. All right, so again, before a dental fillings procedure, you don't have to hold any blood thinner medication. That's otherwise as instructed. And then you don't have any stable INR history, critical and recently, then check your heart, the bleeding risk uh, proceed. Um, and I just say for the feelings, you should not worry about and history of bleeding, but they have life rather than bleeding. Probably do anything at the hospital eye, and they have a puzzle agent push the bleeding back to normal. All right, if you have any further question or concern, write to a dental please let me know in the comment. Thank you. Before a dental root canal procedure, what should you do if you are on platinum medication, such as warfarin, Eliquis, Xarelto, Bodexa? I would recommend you should not hold your platinum medication. Otherwise, as instructed by your doctor or your anticoagulant. If you if you have unstable iron history, your recent iron was critical, too high, then you should check your iron prior to the procedure to make sure you are safe from the procedure. If your iron is therapeutic or you have history of stable iron, good iron history, then you don't have to hold your organ prior to, unless otherwise as instructed by your doctor who manage your organ or the anticoagulant. Or if your dental or your oral surgeon recommend that you hold your platinum medication, then you need to discuss with your doctor who manage your warfarin or the anticoagulant to make sure that you hold the platinum medication appropriately. So if you have unstable iron history or your iron was critical recently, you should check your iron, make sure you are safe. And if you have any active bleeding, you should let your doctor or your anticoagulant clinic know that you have some kind of bleeding, like nose bleeding, stomach bleeding, or blood in urine. You should let your doctor and your dentist, your oral surgeon know before the procedure. Your dental or your oral surgeon may request or may require you to hold your warfarin or your Eliquis, your Atovadexa. So if you require to hold your warfarin, work with your doctor or your anticoagulant, how many days you should hold your warfarin, or what is the iron level they want before a procedure. And then if you require to hold your Eliquis, Xarelto, or Bodexa, then I would recommend you should hold for 1 day prior to the procedure. And if you have to hold your warfarin or your Eliquis, Xarelto, or Bodexa, then you need to resume your platinum medication instructed by your dental or your oral surgeon. If you don't have any instruction or any recommendation from your dental oral surgeon, then you need to check with your doctor who manages your warfarin or your anticoagulant to if they have any. If you have any further question or concern, right, to a dental root canal procedure, please let me know in the comment below. Prior to dental scaling procedure, so what should you do when you are taking a blood thinner medication, that warfarin, Eliquis, Xarelto, Adaxa? I would recommend you should not hold blood thinner medication otherwise as instructed by your doctor who manage your warfarin or your clinic who manage your warfarin. Or your clinic who manage Eliquis, Xarelto, or Adaxa. If you are taking warfarin and you have unstable iron history, then you need to check your INR to make sure you are not critical prior to a procedure. So if you have a critical INR, you should hold your warfarin until your INR back to the therapeutic level or below your range, be safe for the procedure. If you are stable with your warfarin and you have a good INR history in range for a long time, then you may not hold your blood thinner your warfarin. Okay? If you don't have any active bleeding or any concern about bleeding, then you don't have to hold your blood thinner medication prior to dental scaling. If you have to hold your blood thinner medication prior to the procedure, as instructed by your dental, then you need to resume your blood thinner medication instructed. Make sure have a bleeding can control your blood clot, prevent stroke if you don't. Not if you take too long to boom for blood thinner medication. So as one way, you need to check your dentist or your oral surgeon to make sure that they have any instruction for you for the procedure. Let them know that you are on blood thinner medication if they have any instruction. If they have no concern, no instruction, then you should check with your doctor or the anticoag clinics, make sure they have a recommendation, save the procedure. Again, I would not recommend take blood thinner medication before a dental scaling procedure unless otherwise as instructed by your dental. If you are not stable with your warfarin doses, you have unstable INR history, and have the critical INR recently, and you should talk to your doctor or your anticoag clinic. Make sure that they give you good instruction what to do with your blood thinner medication prior to. And then after the procedure, you resume your blood thinner medication as instructed by your dental. You don't have any instruction if they don't know what to recommend, then you should follow your doctor for your anticoagulation recommendation. Safe. Resume your blood thinner medication appropriately. If you have any further question or concern about before dental scaling procedure, what you do, and you are on blood thinner medication. Thank you. Prior to a total knee replacement surgery, so what should you do if you are on blood thinner medication? If you are taking warfarin, then your doctor who manage warfarin for the Formulary clinic, they might reject your INR about 2 weeks prior to the procedure. Depending your INR result or your INR history, then if it's too high, then they adjust your warfarin dose and have you to back in 1 week. And then if you are getting better or get into the range, then they may hold for open for 4 to 5 days prior to the procedure. And if you have a history of recurrent recurrent blood clot or recurrent stroke, then they might need to bridge you with the low injection. And so when they have to push you with the low injection, they need to make sure you have up 2 days kidney labs, within 3 months of your kidney lab, and then your current weight in order to dose Lovenox. There are some instructions regarding when to start your Lovenox injection and when to resume your. You need to follow doctor or make sure you reach the Lovenox injection correctly. And then if you take Aliquid, Gerotobadexa, your doctor, excuse me, your doctor who managed your blood thinner medication or the anticoagulant might check your kidney function. They need to update the labs that needed. Usually within 3 months, and your labs okay. But if it's over 3 months, then they should recheck your kidney labs, your renal labs, so they can give you the good recommendation. If you have a normal kidney function, then probably you should need to hold for like 2 days prior to the total replacement surgery. If your kidney function, if you have some kind of acute kidney problem or have a chronic kidney disease, then based on your PA screening clearance, and they recommend that you might need to go more than 2 days. So if you have bad kidney function, then you might go 3 days off again on your. And then if you have to hold your warfarin for 5 days, your Aliquid for 2 days or more, your Gerotobadexa days or more, then you need to check with your surgeon or the proceduralist to see when you can resume your blood thinner medication. So generally, for warfarin, you may resume your warfarin the day after procedure if okay with surgeon. And then for the Aliquid, Gerotobadexa, yes, the same thing. You may need to resume this medication a day after the procedure. But if you have a bad kidney function and you have to hold more than 2 days, then probably you need to resume your Aliquid, Gerotobadexa
uh, maybe 2 or 3 days after the procedure. Again, you follow your doctor or the anticoagulation to manage your blood thinner medication and your surgeon or a proceduralist. Have any further question or concern, let me know in those.
Hello, Yang. This is a very good question. A lot of people ask me this question when I handle manage the comedy clinic. Yes, some people have to take warfarin and aspirin, but not a lot of people. Some people have to take both warfarin and aspirin. Aspirin generally take for the platelet, or certain people, certain patients have the AFib, but they don't have additional factors, so they only need take aspirin. But when they have additional factors like over over 75, or have diabetes. So generally, the JAK2 score over 2, they should take the anticoagulant instead of take only aspirin. But some people have to take aspirin and warfarin because they have additional conditions. For example, people who take warfarin for the AFib, and they have to take maybe aspirin for the stent. People who have the stent in their body, they may have to take aspirin for 1 year also. Some people have to take the other anti-platelet, like Plavix. So, depending on your medical history, your doctor or your pharmacist will review whether or not you should take both aspirin or warfarin. Thank you for your question. Do you have any other further questions? Please let me know. Thank you. Hi, Yang Ting. This is another good question. I think generally for the major procedure or surgery, I would recommend to hold aspirin for 7 days, but you need to check with the heart doctor to make sure they are okay for the this is a good question. What is the difference between Motrin and Tylenol? I say Motrin is a non-formulary steroid drug. So it's used for mostly for inflammation pain, like ache or muscle pain, muscle cramps, like that. Whereas Tylenol is used for non-inflammation pain, like my headache or my fever or my back. But just pay attention on all the side effects for each of these medications to you. So, Motrin may affect your stomach, like ulceration, when you use very high dose, or you take it in empty stomach. So, and then it might affect your kidney also. So, when you take Motrin, you have to take with a full stomach, and you can take 15 or 13 minutes after eating. And Tylenol may affect your liver. So you should not exceed 4,000 milligrams of Tylenol for any circumstance. So generally you take 500 to 1,000 every 4 to 6 hours, but do not exceed 4,000 milligrams a day. May affect your liver, especially if you have any liver disease. You should consider heavily when you're taking Tylenol. And when drinking too much alcohol, you should avoid taking Tylenol. May affect your liver. For those, this is very important to consider when you should take Tylenol or Motrin. That's pretty much, what is different between Tylenol and Motrin. If you have any further questions, please comment below. Let me thank you. Hi, friend Pam. It's a good question. Basically, this is a general question I used to have. Typically, no, we should not take Motrin while warfarin, because Motrin is a non-formulary steroid medication. It may cause bleeding when taken with anticoagulant, such as warfarin, or Eliquis, Yeroto, any type of anticoagulant, we should not take Motrin. So if you are not allergic, not allergic to Tylenol, you should take Tylenol instead of Motrin. All right, so next medication is warfarin. So when you should not take warfarin, you should not take warfarin if not recommended by your doctor or pharmacist. Okay, if there's no clear indication for you to take warfarin, clear indication like deep vein thrombosis, pulmonary embolism, fibrillation, or AFib. This is a very clear indication. Warfarin. You should not take any active bleed, any warfarin if you are, or if you have any active bleed, like stomach bleeding, nose, or blood in urine. You should not start warfarin if you have active or significant or atrial bleeding. You should discuss with your doctor or your pharmacist to make sure they give you the right doses, or they start with a lower dose instead of normal or higher dose, because the warfarin dosing is very complicated. Make sure you ask your doctor and your pharmacist to have active bleeding or you have a history of bleeding. If you have been taking warfarin and you should have the active bleeding that you need to report to the doctor, they stop it. And if you have life-threatening bleeding, then you need to stop warfarin right away and go to the emergency for further evaluation. And you should not taking warfarin with other blood thinner medication like Aliquid, Yeroto, Rexa. They blood thinner medication, you should complicated medication. If you about switching from warfarin to Aliquid or switching from the other blood thinner medication to warfarin, then there may be some overlap for a few days. For example, if you're switching from Aliquid warfarin, then you need to overlap the Aliquid and warfarin for 3 days, or you stop the Aliquid. Make sure warfarin start working in your body after 3 days, like that, but not taken together in a daily basis. So your prevent your blood or stroke. And when you on warfarin, or you are new to warfarin, and you've been taking the Plavix, and you should check with your doctor to make sure if you still continue on the antiplatelet like Plavix or aspirin. You need to check to make sure you still need to take Plavix or aspirin. And if you have been taking and if you've been taking warfarin, then they just start a Plavix
or aspirin, then you need to let them know you're on warfarin. Make sure, uh, you know, the Plavix or aspirin they want to start, you need it. Sometimes it's not. Sometimes they don't know if you are warfarin or platinum medications. It just start you with the aspirin. Some people have to be on both Plavix or warfarin or aspirin and warfarin because they have different indications. You should check with to make sure you don't have to take the medication that you not take prevent suicide. You should not take warfarin if you're allergic to. And then one more thing for the warfarin. So typically, you should hold 4 to 5 days prior to the major surgery or procedure, colonoscopy, knee replacement, or multiple dental extraction. So you should hold 4 to 5 days prior to procedure. That normally, and presuming that, presume that that your INA level is at the therapeutic level. And if your INA level, at the supra-therapeutic or out range, then we'll have hold your INA, hold your warfarin accordingly. So that is different topic, very complicated. And then, after the procedure, then you ask the surgeon for the procedural list. Make sure that if it's okay to resume the warfarin, maybe 1 day or 2 days after the procedure, if no bleeding. So I would recommend patient to check with the surgeon or the doctor who will perform the procedure. Make sure when it's okay to resume warfarin. So this is very important information for people who have to take warfarin or who have been on warfarin. And when you should report to your doctor, and when you need to go to the emergency room, just start bleeding, high patient. And when you take in the warfarin, then what medication you should avoid. Check with your doctor or pharmacist. Every time you have a new medication, doing over-the-counter herbals, vitamins, check for the drug interaction. That many drugs interact with warfarin, either decrease the efficacy or increase efficacy. Both affect warfarin and affect your body. You check with your doctor. And when you have any kind of bleeding, you need to report to the doctor. Or even you just have abnormal bruising, check with your doctor. You might have too much warfarin in your body, or you may have sick or eat any food that increase INA or increase bleeding. Just make sure you report it. And pay attention, and sometimes they switch you to a new platinum medication, Aliquix, Geronto, then you may need to start warfarin. when you start the new putting the medication like make sure that you start the warfarin if as instructed before any major surgery. Otherwise, they have to postpone your surgery or procedure. You have to wait for a long time. All right, so that is some information that you need to pay attention when taking warfarin or after warfarin. Have any further question or want to clarify anything? Please let me. Right, next medication I would like to share with you is Tylenol. Do not take Tylenol if not recommended by your doctor or pharmacist. I know if somebody just go to the pharmacy store and buy some Tylenol over the counter, if they have eye headache, eye fever, or other general pain. But, yes, you can do that, but if you don't have any additional medical condition, or if don't know how much you should take, like that, you need to ask your doctor how much you understand clearly, or you take any medication over the counter. But you should not take Tylenol if you've been drinking too much alcohol. Drinking too much alcohol, it may affect when you take with Tylenol, the liver. You take your liver, affect your liver, and then it may cause bleeding if you drink too much alcohol, drinking alcohol. And you should not take Tylenol if you have any major liver problems like active hepatitis, cirrhosis, or liver disease. So you should not start Tylenol without checking with your doctor or your father, because it may affect your liver function. And then do not take more than 4,000 milligrams a day. If you do so, it might affect your liver. Very important, you know the dose. How much you can take a day for the Tylenol. So Tylenol generally is safe to take if you don't have any liver problems, if you're not drinking too much alcohol. And if you are on, blood thinner medication like warfarin or Aliquid, Adaxa, it's okay for you to take Tylenol. It's safe to take compared to other pain relief medication. Okay, so and then the last one is you should not take Tylenol if you are allergic to. So the very important information about Tylenol, when and what you should take, and then what you need to pay attention. Caution. Make sure you take the medication safely. All right. If you have any question about Tylenol, please let me know. Thank you. All right, so the next medication is fish oil, omega-3. So the omega-3 or fish oil you can buy over the counter, and it's generally safe to take But I would recommend that you should check with your doctor to make sure you take it correctly. Okay? And I would not recommend that you should take the fish oil if it being expired. Now, you should make sure that it's not expired, so you take the good product. If it's expired, it might cause problems. When it's expired, it's no longer effective like it should, but it increase side effect, like bleeding or cramps, nausea, things like that. The main side effect or that taste, that smell. It might contain harmful bacteria. When it's expired, it might leaking or broken. You may experience some bacteria, and indicate that it may lead to increased risk of cancer. Expire. Make sure take the expiration day and take it correctly. Also, you should store the medication in the appropriate location, not too cold, not too hot. Make sure the medication work like the way it should. You should not take the fish oil if you have any active bleeding. So the stomach, you have stomach bleeding or nose bleeding, blood in urine, cup of blood, or if you have after you take fish oil, you have bleeding, or you have any kind of dark or hairy stool, then you may need to stop taking fish oil. And you should not start when you have any active bleeding. That's very important. The fish oil itself may increase risk of bleeding, may cause bleeding. And you should not take fish oil when you taking warfarin and having critical or elevated iron level. If you have iron level about 5 or 6, it might very dangerous. When you take fish oil, it increase risk of bleeding. And you should not take the fish oil to taking other blood thinner medication like Aliquid, Eroto, Adaxa, or the antiplatelet like aspirin or have bleeding or low hemoglobin. Those factors very important to consider whether or not you should continue taking fish oil or start the fish oil. If you have any of these factors, you need to check with your doctor or your pharmacist to make sure that you don't do any increased risk of bleeding problems. And then if you want to take the fish oil, you should not take more than 2,000 milligrams a day without clear indication. Now, if somebody have some sort of increased cholesterol, then they might take about 2,000 milligrams a day. But if you take more than that and you don't have any clear indication or recommendation, then you should not, because there's increased risk of bleeding, or it may have other side effects. So I would recommend that you should check with your doctor if you want to take more than 2,000 of fish oil a day. And do not take fish oil if you're allergic to it. Okay? It's very important information, and not a lot of people know about this. I've been working on anticoagulant for a long time, dealing with this supplement a lot. I would recommend you should check with your doctor and your pharmacist if you have any active bleeding or if you blood thinner medication are safe from bleeding. And you should not take this medication when it is being expired. And then when your iron is very high, like critical level or elevated, just stop taking this oil or do not start or eat a supplement or water cup. All right, if you have any question about this over the counters, this medication, please let me know in the comments. Thank you. Right, next medication I would like to share with you is Tylenol. Do not take Tylenol if not recommended by your doctor or pharmacist. I know if somebody just go to the pharmacy store and buy some Tylenol over the counter, if they have eye headache, eye fever, or other general pain. But, yes, you can do that, but if you don't have any additional medical condition, or if don't know how much you should take, like that, then you need to ask your doctor or pharmacist to make sure you understand clearly before you take any medication over the counter. But you should not take Tylenol if you've been drinking too much alcohol. Drinking too much alcohol, it might affect when you take with Tylenol, it might your liver. You take your liver, affect your liver, and then it may cause bleeding if you drink too much alcohol. Drinking too much alcohol. And you should not take Tylenol if you have any major liver problems like active hepatitis, cirrhosis, or liver disease. So you should not start Tylenol without checking with your doctor or your family, because it may affect your liver function. And then do not take more than 4,000 milligrams a day. If you do so, it might affect your liver. Very important, you know the dose. How much you can take a day for the Tylenol. So Tylenol generally is safe to take if you don't have any liver problems, if you're not drinking too much alcohol. And if you on, blood thinner medication like warfarin or Alquist, but that's it's okay for you to take Tylenol. It's safe to take compared to other pain relief medication. Okay, so and then the last one is you should not take Tylenol if you are allergic to it. So the very important information about Tylenol, when and what you should take, and then what you need to pay attention. Caution. Make sure you are take the medication safely. All right. If you have any question about Tylenol, please let me know. Thank you. All right. So the next medication, Motrin. This is also available over the counters at the pharmacy like CVS, Walmart, or Walgreens. So you can buy over the counter, or can get prescription from your doctor. But you should not take Motrin or ibuprofen if it's not recommended by your doctor or pharmacist. And you should not take the Motrin if you are on empty stomach. You don't have any food in stomach. Might cause problem, stomach ulceration, or bleeding. So make sure you eat before you take Motrin or ibuprofen. If you have major stomach or kidney problems, you should check with your doctor or pharmacist before you take the Motrin or ibuprofen. So major stomach problem like peptic ulcer or gastric problems, or heartburn, or GI bleeding or stomach bleeding, blood in urine, or kidney problems. You have the kidney dysfunction or renal problems. You need to make sure you talk to your doctor or pharmacist before you take Motrin or ibuprofen. Okay, so if you are taking warfarin, blood thinner medication like warfarin, Eliquis, Xarelto, or Badaxa, etc., you should not start the Motrin or ibuprofen. If you have, headache or back pain or toothache, things like that, you might try some Tylenol instead of Motrin. Because Motrin may increase the bleeding risk when you are on warfarin or Eliquis or any blood thinner medication. So, and if you taking Motrin or ibuprofen, you've been taking Motrin or ibuprofen, then you should talk to your doctor who give you a new blood thinner medication like warfarin or Eliquis or Badaxa. You should let them know you're on the Motrin to avoid any increased bleeding risk. And you should not take Motrin or ibuprofen more than 4,000 milligrams per day. If you take more than that, it might cause very serious side effects like stomach ulceration or bleeding, and it may damage your kidney. So make sure do not take more than 4,000 milligrams of Motrin or ibuprofen per day. And you should not take Motrin or ibuprofen if you're allergic to it. This very important information. If you have been taking Motrin or ibuprofen, or if you will take Motrin or ibuprofen, pay attention to this information. Very, very important. If you don't follow the recommendation from your doctor or pharmacist, you may have problem with medication. Most of people have stomach ulceration that they didn't take the medication correctly. They take on their empty stomach. That easily cause stomach ulceration. And it may damage your kidney. You take too much Motrin, like overdose of, or more than 4,000 milligrams a day. and you might have some kind of bleeding, maybe centric bleeding, when you take with warfarin or Eliquis or any other platinum medication.